I came to Women's Care before I had my first daughter. She was born in March of 2006, and I just did some asking around, and I knew some people who worked as labor and delivery nurses at various hospitals, and it seemed like all of them were pointing me in the direction of Women's Care. And I couldn't be happier with my choice. The care you receive at Women's Care is top-notch. Whether you're seeing your normal doctor, or if your doctor's out and you need to see another doctor or one of the nurse practitioners, each of them will treat you just as importantly as they do their regular patients. They don't, put you secondhand because you're not their regular patient. They will give you just as much care and attention as they would their regular patients. I'm thankful because I think I have 2 healthy children because of them. I had 2 high-risk pregnancies, one of them with gestational diabetes, and the other one with advanced maternal age and some intrauterine growth restriction with this little guy right here. And if it wouldn't have been for the careful monitoring of the doctors and the staff at Women's Care, things may have turned out a little bit differently. If Dr. Clark hadn't found that he wasn't growing in utero, we could have had, a not so happy situation occur. I would recommend Women's Care to anyone, and I have recommended Women's Care to so many of my friends and family. As soon as I hear someone say, I'm expecting or I'm thinking about starting a family, where do you go? Would you recommend anybody? Right away I'll say, Dr. Clark was an incredible doctor, and I would recommend her in a second. If she's not accepting new patients, I would recommend anyone else at that practice because, like I've said, they're just amazing doctors, nurses, technicians, nurse practitioners. I don't think you can go wrong by choosing any one of them. I'm glad that everything worked out the way it should have, and I couldn't have asked for better care.